Hello and welcome back to another episode of Health Yes. Here at Cameron County Public Health, my name is Javier Chavarria.
I'm Enrique, DeAnda.
And today we will be discussing child abuse prevention. Joining us today is Ms. Lacey Ambriz, Communications Director at CASA, and Ms. Lidia Vasquez from the Children's Advocacy Centers of Cameron County and Wensley Counties. Welcome to the show.
My name is Lacey Ambriz. I am the Communications Director / Facility Dog Handler at CASA of Cameron and Wensley Counties.
Mm-hmm.
Our office is in Brownsville, but we serve both counties. So from the island all the way to Raymondville is the children and the families that we cover.
Right. And the Children's Advocacy Center, where is that located?
We have an office in Brownsville, an office in Harlingen, and then a satellite office in Raymondville. So we have 3 locations.
I think the biggest problem is a lot of people don't realize that these resources exist in Cameron County. And I think that they might have some difficulty reaching out to you. So I'm open to hear, what do you feel would be the best way for someone to get a hold of you?
So for our office, it's CPS or law enforcement that would have to make the appointment with us. But the one thing I can say is if someone sees something, to say something, because that's the only way that we're going to get those kids help. But yeah, just always reach out to your local law enforcement or any CPS or DFPS, stuff like that.
We actually come on after the children have been removed and placed into foster care. So we are appointed by the judge, and the case comes through our office, and we have our system, our program director reviews and views the case and see if we have available staff and also advocates to take on this case.
Yeah, I think that's the biggest issue is that when something like this happens, it's usually, I think as a parent, like I put myself in that situation because, obviously I have 2 boys. And I think of a scenario where if something like this happened, I wouldn't know where to start. And obviously it's easy to get mixed up between the 2. So it's nice to know that there is the initial contact with a Children's Advocacy Center and then the follow-up with CASA, which I think it's a helpful structure for parents to have.
Primarily, we represent the children's best interests, especially in court, amplifying their needs and our concerns, but we also engage with their family. So at the end of the day, we do want family reunification when safe and possible, but it's like being a caseworker, but they're a volunteer.
Exactly. I mean, obviously, you guys have had a lot of experience working with a lot of different people and children and scenarios and situations. So what do you think? Would you say you have anything that you've directly learned from that situation? Maybe help get people talking, make it a little easier for people to come to grips with this very touchy subject.
I go to the schools and I do play it safe presentations. So one thing that I really try to get across to the kids is that it's never their fault. Because I feel like a lot of kids can feel like, oh, I did something to deserve this. And there's no way that a kid could ever do something so bad to deserve anything that they go through like that.
Yeah, I think that's very important because, again, it's a very touchy subject and I don't feel everyone's always comfortable talking about it. So the fact that you're in the schools and making yourself available to them. And I think kids, especially, once they see you, they feel more comfortable around you and then they know they can trust you. And once you got that, I think they're more willing to open up to you. So I think that's really important.
We've actually been in the community for 29 years, and I still come across people who've never heard about us or what we do. So I love to get to share about our mission, the need for volunteers, but we're also shown a lot of families. I mean, we all come from different backgrounds, so we all have our own personal bias. So when we come into this line of work, it's breaking down that and getting to know these families and not having a judgment.
You had mentioned your facility dog.
Yep, Mr. Forrest the Eighth.
I remember someone here in the office has your business card.
Yes, he's very, very professional. We got him about 1.5 years ago. I'm his handler, so he lives with me and I take him to work, but we got him to be there for the children. So we'll go and visit them in the shelters, the foster home. But a lot of the time we are there at the courthouse, just hanging out with the kiddos because the judge does want to see the children. He wants to make sure they're okay. So being there at court, it's a foreign environment. Like they're nervous, they're intimidated. There's attorneys walking in and out, there's CPS workers. So we're there to hang out with them and just provide them like with a level of comfort.
What are his specific duties, or their specific duties?
So he's a certified facility dog. He's got the same training as a service dog, but since I as his handler do not have a disability, I use him for a professional work environment. That's why he's titled facility dog. But he knows over 40 commands, and our next goal is to actually use him to be under the witness stand when children have to testify.
That's amazing.
And there's nothing like him down here, so I'm
That's the first time I've ever heard about anything like that.
so really happy to have him, and he's just another tool we get to use to help these children.
Oh, that's great. I mean, obviously kids like dogs, and I believe I've met Forrest once or twice before.
Probably. We were here last year for the walk that you did.
I was surprised at how calm. I was like, if I ever had a dog, I'd want a dog that is this calm, because every dog I've ever met is like hyperactive or something. But yeah, no, it's great, and I can see where a kid would definitely feel more comfortable, especially in a courtroom. That is one of the most nerve-wracking environments you can think of. It's just everyone's so official. Everyone's in their uniforms. There's guards everywhere. You got to go through a metal detector. So I think to help, distract from the situation, I think it's great.
I've seen children's demeanors change. I've seen the adults' demeanors change. The attorneys, when they're like going at it, and then they come over and pet him, they're like, okay, I needed this. But it's just
the judge
makes you feel good.
The judge bangs his gavel. And he's like, "Court is adjourned." Oh, who's a good boy? Who's a good boy?
We probably needed Forrest here for the beginning of this podcast.
I know. This would have got. So, Forrest, do you have any appearance? Oh yeah. That's great. I think that's the biggest issue we have sometimes, is that we're still very rooted in our ways. And we're not always willing to open up to people, and we're very private about certain things. And especially, again, something as big as child abuse is not something that many people like to talk about openly. But again, it's just being there and being able to, be inviting and have people open up to you so that you can like touch on the subject. It's great that you're doing this work. And so obviously, aside from your agency, like specifically, is there something that, how does your agency go about being a resource for for keeping children safe?
Like what we do there is the forensic interviews, which is the kids go in and it's recorded so that they don't have to repeat their story over to different CPS, different law enforcement, stuff like that. We also have our family advocates, which is actually what I started as. They're support. They do referrals for different resources. Once someone's a client, if let's say they're interviewed at 3, they're a client for life. They can be 18 and up and they're still clients. So if they ever need therapy, we can still refer them and it'll be free of charge. We also do MDT staffings. So that's when we get together with the different agencies, the DAs, the CBS, the law enforcement, all the other advocates. But yes, we just so we can help the case keep going so that it doesn't just get closed and we forget about it. We also do the outreach, like I said. And I don't think we've had a support group any recently, but that is something we used to do before COVID. And hopefully, I think that would be a great thing to start up again.
Yeah, I definitely think anytime you can get a group of people to talk, I think it's very therapeutic, and I think it's a great resource to have people that like, well, I'm going through this. Well, I'm going through this too. So I think that's great. But yeah, I mean, we're all readjusting to life after COVID. So I shouldn't say directly after, but things are opening up again, and we're slowly getting back to normal.
A resource that we have is being able to have a volunteer on that case. Even though we don't provide any direct services, we don't have any counseling, we can't give any legal advice, we can refer them out to services that we have in our community. So it's not only vital for the child, but beneficial to their parents who are also struggling and needing help. So we're very much trying to preserve families.
What is the origin of Monica and Maggie's house?
These 2 houses are dedicated to the memories of 2 small girls from our community. Monica's house is in Brownsville. It was started in 98 after the death of Monica Castillo. She was 5 or 4 a little under 5. And then Maggie's house is after Margaret, also known as Maggie June Dittman. She was around 2, and they were both victims of child abuse, and they passed away. That we chose to name the houses after them.
I've always been curious about the name of the houses.
And our satellite office in Raymondville, it's going to get its name on the 25th anniversary.
Oh, really?
Mm-hmm.
When is the 25th anniversary?
It's going to be in April. We're going to have something in April over there, and we're going to name the house.
Where can people like go to find out more about Monica's and Maggie's?
They can always call our office. 956-361-3313.
There you go.
They can just look us up. Our number's there. How to contact us. It should have someone's email. We have a Facebook.
Mm-hmm.
It's Children's Advocacy of Cameron and Willacy County.
Perfect.
Mm-hmm.
And if anyone wanted to know a little more information about CASA,
They can call our office. Our office is in Brownsville, but we have our volunteer coordinator who's always at events, doing speaking engagements, outreach. We do have a Facebook page. We have an Instagram, and then only our facility dog has a TikTok.
You did mention something right now. It's just volunteers. How would someone go about volunteering for CASA?
Calling our office, they can send us an email. They can reach out to us through one of our social media outlets, just that they would want more information, because when you first hear like, oh, coming on and becoming an advocate, it's quite intimidating. I've come across people who are just like, I don't think I can do this. This seems a lot of work. But when you break it down and talk to them about, what our mission is and what our goal and some of the positive things that we have, it helps,
Yeah, I think in both scenarios, it's very easy to get overwhelmed with, again, child abuse. But I think by obviously talking to people and presenting it in smaller sections and telling them, well, you can help by doing this. Mm-hmm. You can help by just doing this. Spreading the word, sending people to us, give someone our card, put them in contact with us. And people don't realize that even that little bit helps a lot. Again, spreading awareness of what you guys do for our children here in Cameron County. Mm-hmm. So that's amazing.
We're just in the need for volunteers, but if someone could not volunteer, then of course, if they wanted to do like monetary donations, that is always welcome too.
Are there any qualifications for volunteers or?
Yeah, they have to be 21 and over, able to pass a background check, and attend a free 30-hour training that we provide.
Awesome. Well, thank you so much again, Lidia and Lacey, for joining us on this episode of Health Yes.
Thank you for having me.
Awesome.
And all our listeners, please remember to like, subscribe, and follow us on our social media.
Thank you so much for joining us, and stay tuned for another episode of Health Yes.